Hi, everybody. Welcome back to the Doctor and Duo podcast, where two medical students give you honest, unfiltered, and real person opinions and feedback on what medical school and being a pre med is actually like, from formerly average pre med to your average pre med. My name's Eleni. I'm in M1 at Penn State College of Medicine. And as a reminder, I speak only for myself and not for my institution.
Hey everybody, I'm Noah. I'm a first year medical student at Mayo Clinic Alex School of Medicine. And similar to Eleni, I only speak for myself and not my institution.
All right. So today we're coming back with kind of maybe a topic we should have reserved for Halloween, but I think an important topic nonetheless. So we're here to talk to you guys today about anatomy, like what anatomy is, what it entails, and how we studied for it and how we succeeded with it. And we wanted to record this episode earlier, but Penn State doesn't start doing anatomy until November. So taking my first anatomy exam, I passed, thank God. Noah's taken many, I'm sure. So we're here to give you guys our feedback from the battlefield. So to kick us off, talking a little bit about how the courses are structured. Noah, do you want to talk about how Mayo does their anatomy courses?
Yeah. So starting out with how Mayo organizes our anatomy course and to give a background. So anatomy is really about the structure of the human body. Function is kind of reserved for physiology. And at least here at Mayo, we do that in our organ system blocks, and some schools have a whole physiology course. But how anatomy worked here is that it's 7 weeks. We covered the entire human body in that 7 weeks. For us, it was entirely virtual. We had a specific emphasis on, we had like 4 hours a day. It was from 8 to noon, entirely virtual. We had prosected body specimens, which they would actually do like a lab tour, and they would actually take fiber optic cameras and like go into body cavities and stuff. Really cool. But then we also had optional lab time during the afternoon in which we could go in and actually see and touch the bodies and get a feel for those structures. We also had a specific emphasis on radiology. So specifically x-rays, most notably chest x-rays were a big one. And then CT scans. So chest and abdominal CTs, and also head CT as well. But you get more into that in neuro. Um, and then our final, and we'll get into exams a little bit later, but just as a precursor, we had an NBME, a National Board of Medical Examiners exam for our final. And we also had a lab practical in which they put a pin in a body or an arrow, and then we had to identify what that structure was.
What did the timeline of your class look like? I'm kind of curious.
Like as far as like how long, or in terms
Yeah,
of.
so like was it just like all grouped up front? Like how long did that take? Was it spread out?
Yeah, no, it was definitely all condensed within that 7 weeks. As far as like how they organized it, as far as the timeline, they tried to make it semi-logical. So we kind of started at like um kind of like the thoracic region, and we kind of like went down to body, and then we went back up to head and neck, since head and neck had like a lot of structure. So that was kind of like the last part. So we started with like the shoulder and like brachial plexus, worked our way down to the thorax and the abdomen and the pelvis, and then ended up back at head and neck. So that was kind of how it was structured.
Cool. So just as kind of a personal curiosity, so did you guys actually have cadavers?
Yeah,
Or
we did have cadavers. So the we kind of had two separate interactions with our cadavers. Part of it was in the anatomy lab, they had a whole multi-tech studio in which
Mhm.
they had fancy camera setups. They could show us different angles of the bodies and how professional anatomists had dissected the bodies, and show us the key highlighted structures that they want us to know. Then in the
Mhm.
afternoon, we had lab time where we would actually, put on gloves, put on like PPE, and then go in and actually get to touch, see, and feel the bodies, and see it for ourselves without somebody walking us through it.
Did you guys get to dissect yourself?
No, so I should add that caveat. So at Mayo, you do not, as a first year, you do not dissect your own bodies. I've previously talked about selectives. I believe it's in June of this year, so 2023, where first year medical students, you spend a whole week just dissecting, and you get to learn from one of the top anatomy educators in the world. He's going to walk you through how you dissect a human body. So they kind of reserve that once you've kind of had anatomy and you know your way around the body, instead of kind of, I guess their logic is so you don't go blindly cutting into structures that you don't know where you are just yet.
Got it. Yeah, so we're a little different on that end. So we don't start off with anatomy. Penn State's a little weird. I don't know how it is. I think at a lot of schools they start you guys out with anatomy. Um, Penn State's weird. They have this very big focus on like holistic, humanistic, all that good stuff. So they really like ease you in your first few weeks of medical school. So we didn't start anatomy until November. As a note, we started medical school in July. Um, and so we started with thoracic, so mediastinum, lungs, and cardio anatomy. And so basically, we all get cadavers. So it's two groups per cadaver, two groups of four. So group A dissects the right side, group B dissects the left side. So that's kind of how they split it up. And so like it'll be like group A will remove the heart and group B will remove the lungs and that kind of thing. So we do all our own dissections, which could be a good or bad thing. We definitely made some cuts that we probably weren't supposed to, but I guess Penn State's philosophy is you kind of learn in the process.
Yeah.
Um, for example, we had to make a sagittal cut of the breasts. Um, we did not do a very good job of that. It was almost like I hate to describe it this way, but it was almost like filleting cuts because we cut the wrong way because we were trying to look for lobules. It was just an unfortunate experience. Maybe not a good reference for me being a breast surgeon, but I think it was a really good learning experience to do it hands on to say, okay, we're digging through the thoracic cavity. Hey, that's the phrenic nerve, or hey, that's the vagal nerve. And it's like, let's see how easy that is to damage it in surgery, kind of thing. I got to use the bone saw on the sternum, which was
Oh,
pretty cool.
nice.
Stressed me out because it went really fast, and I was trying my best not to have it puncture the heart. And then what we do is we were very concentrated on anatomy in the first few weeks of our cardiorespiratory block, and then we took our exam, and now we're done with anatomy for this block, and now we focus on pathophys. That's not the case with all blocks. I know for example, renal is our next block. We're going to be doing renal anatomy concurrently with pathophysiology. So it's just going to kind of depend how they want to structure it. But basically, we do the anatomy for each organ system. We finish that organ system, and then we move on. So it's very much in organ systems. So you're kind of applying what you learn immediately so that it sticks, right? So instead of saying, "Oh my gosh," you know, the posterior descending artery runs with the middle cardiac vein. I hope that's right. I think that is. And forgetting it tomorrow or forgetting it in 3 weeks, it's kind of saying, okay, now I'm going to look at a case where there's, an occlusion in that artery, what vein does it run with? So you're forced to kind of think about it constantly. I like that system in some ways, but I also feel like it would have been nice to just get anatomy over and done with,
Yeah.
in part because it's a lot, it's very overwhelming, a lot of memorizing, and also I hate the smell. I hate the smell. I can't stand
Yeah.
it. But yeah, that's kind of how Penn State formats it. So I think that's really the two main formats I would say that you would see in medical school.
Yeah, I would say you either do it all at once, like I did. So you kind of actually, luckily for our listeners, you kind of got the two different perspectives that you'll see. You'll see all at one, or you'll see it, you know, again, kind of in chopped up manner through your organ systems. So neither one's really a wrong approach. It's just, different approaches to the same subject matter. And I'm not sure it's something that you want to base your medical school decision on, but something to like keep in mind as you like are looking about choosing where to go.
You'll learn anatomy like either way. I
Yeah,
I
either
would
way
only
you'll
say like
learn it.
the only red flag I would use like if it's totally virtual, like you are not touching or seeing a body. I think that was very helpful for me personally. It's like be able to actually see and feel and like put my hands in the thoracic
Yeah,
cavity and be like, oh, that's where the endothoracic fascia are, because like unless I was ripping off that pleura, I wouldn't have been able to see that or understand what they were talking about.
yeah. I will say it is super useful being in the cadaver lab. I think, it provides a good benchmark knowing that a lung is less dense than a liver and being able to feel it. And, that's just something that you'll never really get unless you go into pathology, the opportunity to see really again or maybe like transplant surgery, but it's not really something that you'll routinely see again. So it's really a unique opportunity. And kind of like how May awarded it, our cadavers were our first patients. Um, it's, getting experience, interacting with the body, seeing all the different structures, and like thinking about all the things that can go wrong, even if they're not formally teaching it. As you look at a lung, you're like, what are the things that affect the lung? So it's kind of like that intro to thinking like a doctor a little bit.
Actually, speaking of density, that reminded me, we also do imaging, but our imaging tends, so I'm not sure totally how imaging works for later blocks, but we also had like imaging lectures and imaging classes that were accompanying our anatomy lab. And then in our anatomy exam, we also got an imaging portion of our exam. And we did CT, we did cardiac angiogram, we did MRI, cardiac MRI, we did like a variety of things. And so we were given a lot of exercises to be like, hey, what's this? I will say that was definitely not my strong suit, because I would look at something and be like, that's a circle or that's a blob, which is not super helpful or
Right.
academic. I don't know how your experiences were, Noah, with imaging, but I really struggled at the beginning, just kind of like orienting myself.
Yeah, I think it's definitely something where I didn't have, and I don't know about you, I certainly didn't have a lot of radiology exposure prior to um coming to medical school. So it's similar to like the language of anatomy, the language of radiology is like vastly different, and getting used to knowing like, am I in a sagittal plane? Am I in a coronal plane? And like, how does that shape what the organs and different structures look like? Um, so it's just different. You get used to it. At Mayo, we also had imaging on our exams. Like we had some images of like what they'll ask you like, which bone is this? And you'll be like, the scaphoid. And it's like, what's a clinical correlate? And you'll be like, foosh, fall on outstretched hand. So it's like stuff like that. And then one thing that was kind of cool is, in addition to like our physical cadavers, which we would go in and see in the lab, we had like kind of this longitudinal piece of the course where we had our own body on radiology, and we stuck with that body, and we had a radiology assignment each week, and we would identify structures on CT. So you kind of got long form exposure to that, and like you actually got to use some of the software. So kind of got to be a mini radiologist. So that was cool.
That's awesome. We've been doing some cardiac ultrasound lately,
Oh, okay, cool.
but we've been doing it on like the little dummies, the practice dummies, which I don't feel like it's too perfect, right? Because when you're with a real patient, they're gonna be squirming, or
Yeah.
they got a chunk of tummy fat or something there that makes it hard to kind of navigate around. Um, so that's really cool that you guys get. I think not a lot of schools do the imaging thing right off the bat.
Yeah.
So I think we're very lucky in
Yeah.
that sense, to get that imaging experience. But yeah, I can't get over like, so like I said, they actually make us do the actual dissection, and I was like, how are we gonna cut through bone, right? And I'm thinking like in my head, like like in the movies or video games, it's like bone saw or like whatever, like bloody what this and that. And the guy's like the M2 that's teaching us, he's like, yeah. Hold on, let me go show you the tools. And he goes and gets a saw that's literally like you would make like a wooden rocking horse out of it. You could go to Home Depot and get for $15, and brings garden shears. And so when we were cutting through the rib cage, every time a bone cracked, I was like, oh. So I'm not cut out for ortho.
Definitely not an ortho bro here. Also,
Oh, ooh,
sounds of bones breaking, just can't do it. Sorry.
well, yeah, that and throwing up, but that's a different thing. um, So, I feel like we've been tested in our cadaver labs by the sights and the smells and the sounds, but we were also tested using exams. That was a great transition.
Yeah. Yeah, perfect
So
transition right there.
do you want to talk a little bit about how your exams are structured?
Yeah, so for anatomy, we just kind of had we had some like, so I mentioned the radiology assignments. Let me see, I have it pulled up here. We had a little like presentation based on our radiology assignments. Um, Other than that, it was just a straight up final. we had one final. There was no midterm. Um, so we had two. So for our lab practical, like I sort of mentioned, it was a pen placed in a body. You had to identify that body part. We also had radiology images, and it would be like identify this bone or identify this muscle or this vessel, etc. Then for the MBME exam, which I think is actually one of the hardest subject tests if your school offers MBME exams, it's definitely one of the hardest exams. Um, just because there's a lot of clinical correlates. And I think if you were just going into that exam thinking you could get away with just they're going to ask you questions like this bone is what or this muscle does what. It wasn't like that. It was you very much needed to know um, what the correlates would be of what you're going to be seeing in the office. So that kind of like threw some people off. But so that was about 125 questions, if I recall correctly. So definitely stressful course in the sense that a lot of your grade is depending on those two exams, and it's at the end of the course and it's cumulative. But I got through it. I'm here. I'm still breathing, so it's all good.
So I'm sorry, you had two exams for the entirety of body anatomy.
Yep, two exams for the entirety of body.
So they could ask you, theoretically, they could ask you like a mediastinum question, jump to like reproductive system, and then jump to like a cranium question.
Yeah, no, in fact, on like our practical, you could very much get asked which branch of the brachial plexus is this, then be asked about one of the tiny muscles in the foot, and then go back up to the head and like get asked what fissure is this. So yeah, it was definitely you had to know your stuff because it was definitely
Wow.
not even organized by system. It wasn't like heart questions, then like lung questions. It jumped all over the place. So it's definitely tough.
Yeah. I so our, like I said, ours is by body system, which I guess makes it life a little easier. In the sense that it's like, okay, I'm not gonna get asked something weird about like the uterus or something. Um,
Yeah.
when I'm studying the heart. But I agree. I think that a lot of students, like, especially if you did anatomy in undergrad, it's kind of like, oh, what muscle is this? Or what nerve is this? Or what artery is this? Or like maybe on the harder end, like, what does this drain into? Or what does this drain from? Or something like that. Like, let me think. Like we had questions like if like a child was running with a piece of gum and like he choked on it, like,
Mm,
and then it was like the right lung and it was labeled and it would be like
yeah.
which lobe is the gum most likely to end up in. um did you get that question?
Yeah, those are very common questions. For those who don't know, for like lung anatomy, usually your right bronchus is straight, so it usually ends up in your right lung. And I think it's the lower lobe. I forget. It might be the middle lobe. But yeah, those are common questions that you
I think I
get.
put
Yeah.
middle lobe and I got it wrong, so don't be me. Yes, but it is right lung because it's a little bit wider and a little bit more vertical, so gravity says go that way.
Yeah,
Yeah, so questions like that, I found BRS anatomy super helpful when I was
interesting.
studying.
I
Um,
heard about board review series, and we'll get a little bit to how to memorize and study later on in the episode. But yeah, that was one resource that I actually didn't get to use before the exam because there's just so much. There's so many
yeah.
resources.
Well, I mean, I use Morse clinically oriented anatomy, which I thought was a little bit too much of a time sink. I
Okay.
also made my own Anki decks for this because we're
Okay.
given like course materials, so we're given PowerPoints that we have to like memorize before we come into
Sure.
lab. So I made Anki's like my own Anki, and that's like my biggest study resource.
Smart.
I guess we're kind of this is later. I guess we're kind of because what else do we have to say about exam structure?
Yeah, that's true. Yeah, we've already done. So yeah, we can talk a little bit about application of pathophys and then yeah, how to remember. So how about we jump into resources since we're kind of already on the subject. So
Yeah, I will say one thing. Last thing about examinations is that I don't know how your examination was, but like it's very jarring to come in and like they will have all the cadavers open. At least for us, they had all the cadavers open. We have two big like auditorium sized rooms that they store them in, and like
mm,
you will go from table to table. Things will be tagged, or at least for the practical portion. The written exam was taken on our computers. Type an essay, do some multiple choice questions, which are pretty hard in my opinion. Um, But like for us in the practical, we rotated station to station, and they would have like imaging pictures, or they would have like some structure tagged and be like what is the structure, or what is the structure feeding. Um, like for example, there was one is like if you damage this nerve, like what will happen? And it was like the
Wow.
left recurrent laryngeal nerve, and it's like hoarseness of voice, stuff like that.
Yeah.
But yeah, it's very jarring, at least in my opinion.
Yeah, no, you kind of got the traditional practical exam experience. At Mayo, we always do things special. So we had we had a computer exam for both actually. And for better or for worse, you got a picture. You couldn't really move around the body and see whatever structures. So you had to be comfortable with maybe seeing an angle of a structure that you weren't used to. So it has its pros and cons. Pro because you don't have to go anywhere. Con in the sense that I think maybe I don't know if you took advantage or how you approached your practical, but I think when I was in the lab, one thing that was really helpful was the context, of knowing like where you are. And sometimes that can't be conveyed in a picture. So just one of
Yes.
those things.
Yeah, Penn State was big on that. It's like, for example, like learning the splanchnic nerves, like you had to know like which like T I can't remember now, which is bad, but like T10, like what branches off of that, T8, that kind of thing, and like they would not tell you, and they'd be like, okay, you would have to know like this is T8 or this is whatever. So they were big on context, but like you said, there's pros and cons to both styles. But
Yeah.
yeah, I think we're ready to move on to studying.
Yeah. Yeah. So you mentioned board review series. I'll talk about some of the resources that I personally found helpful going through anatomy. Eleni mentioned making her own Aki deck. Unfortunately, I didn't have the willpower to do that because it was the entire body, and I just would have gotten burned out super quick. But I did use Anki, watched some videos, untagged the corresponding cards, and did it that way. I think of all the courses in anatomy is something that Anki is really helpful. It's pure memorization. The branches of the brachial plexus aren't going to change. So it's just one of those things. So Anki is definitely a resource. I think oh yeah, I use KenHub. KenHub, some of you might have heard of it. They have anatomy. I believe they even have histology, and they even had some radiology sections. Super useful. They had videos, they had articles for each of the corresponding videos, and they even had like some good 3D models. We talked about it in previous episodes, but one thing that I got preparing for my practical, like Eleni actually shared it with me, was med school boot camp, a little bit of a newer resource, but they also had really excellent videos for anatomy, and they had really good practical exam images, which I used in preparation for my practical. Let me see. So KinHub, med school boot camp, Anki. I think those were the main resources for me. I'm one of those people where for each given block, I try and find two or three things that I think kind of work for me and stick with those instead of bouncing around.
Yeah. I did a lot of bouncing around just because I was just trying to figure out like what worked for me. I used more clinically oriented anatomy at first, which looking back, I don't think I would use it again just because like it's a great resource, I would say, especially for like pathophys relationships, but it's just so dense.
Mm,
Um, so I would say like emphasize what your school is giving you. So our school makes PowerPoints, like they make the anatomy PhD students make like presentations for us that we have to learn. And so I made Ankis specifically from those presentations. And then because those pictures were from like netters and that kind of thing, what I did was I coupled it with Michigan U-Link, Blue
okay.
Atlas U-Link, or
Yeah.
whatever it's called. And that was super helpful because I had like tagged pictures that were very clear. So that was really helpful to me. And I think the biggest thing that was helpful, at least in terms of studying, was me and my friends, we would get up on a weekend and we did this like 3 or 4 times, and we would go in and they give us a list of structures you have to identify, and we would ID every single structure. And we would switch cadavers as well, like learn off of ones that just weren't ours because you're going to have to do that on test day. And I thought that was really, really helpful. So I would say like anatomy is not as passive as people think it is.
No.
At least as passive as I thought it was going to be. which was, oh, I'm gonna sit here and watch a video, memorize it, take some notes or whatever. Like it's a very active learning process where you need to be touching things, you need to be seeing things, you need to be drilling things. Um, it's a grind. I don't know how long it took you to study for that exam.
Yeah, it took me quite a bit. I mean, fortunate, you got to remember, like, it's for me, it was the entire human body. So it was very much, if it wasn't repetition and going into the lab every single, for me, and I'm sure you were probably in the lab every day too, but for me, it was every day I'm going into the lab for at least half an hour to an hour. Um, and I tried to do that as much as I could. I think that is important, to see things, to touch things, to converse with people who are also confused about the same things that you're confused about. You can share in your solidarity of how much you're hating your life right now. Um, and that's just, I think, like you said, it's irreplaceable, that physical experience. And it's not just this class, but a lot of things in medical school. When you can go in and see and touch things, you should go in and see and touch things and hear things. Um, a couple of other resources that I'll mention. In addition to Michigan Blue Link, sorry, can't speak today. Um, there was also there's this PDF. It's like 100 concepts that you need to know for anatomy. I think it's somewhere floating out there on Reddit, but super helpful, super high yield for the if your school does the MBME exam. So that was also, I did that like in the 3 or 4 days leading up to the exam to kind of like drill down, like, what are the 100 things? And 100 is a big number that like I absolutely need to know. So yeah.
Um, I almost forgot what I was gonna say. Practice problems. That reminded me. Practice
Practice
problems.
problems.
So, I use the anatomyguy.com, and the reason why I use that, it's a really good question bank, by the way. Really good questions, a lot of pictures, a lot of like you can build your own quizzes based on topics. But the reason why we used it was because the guy who made the website was our anatomy professor who was making the tests, and he made it while he was at EVMS. Actually, I was talking to him about living in Virginia Beach. No, it was crazy.
Oh,
It was
really?
crazy.
Wow. That's
We lived 2 minutes from each other in Virginia Beach. It was
wow.
frightening. I know, small world. But I thought that was really helpful. I also used I'm trying to see if I have it on my shelf. I don't. I also use Gray's Anatomy Review for like
Okay.
practical questions. So it was like, again, it's that application. So like, do you actually know what the posterior descending artery is doing? Do you know what the circumflex artery is doing? You know, that kind of thing, which I thought was helpful, and it would give you like a clinical presentation. Be like one that was really popular was like if you've been stabbed like in the chest, which is horribly violent, but if you've been
Horribly
stabbed in
violent.
the chest, like what structure is most likely to be injured, and you would have to know, okay, the heart is in the most interior part of the heart, it's gonna be the right ventricle. That's what you're gonna be
Yeah.
sadly stabbed in. Very sad. Um, so do practice problems. Don't just passively click through cards. You need to
Yeah.
test yourself.
Yeah, I will add, because I think they make you guys do essay answers, which definitely is definitely harder than simple recognition. But I will say that practice problems are incredibly helpful even for the MBME portion too, because you might think you know anatomy, but those clinical correlates, and when they present a clinical scenario, it's not as intuitive as you might think. You studied the heart, you know what it does, and then they give a presentation about, I don't know, you hear like a harsh 2 out of 6 systolic murmur, whatever cardiologists say. It's not important. Um, sorry, cardio buddies. But it really makes you think, and you really have to rack your brain. So you have to think in a certain way, of get out of like the undergrad mindset of just knowing a structure and what it does is enough. You have to be able to apply it, and it doesn't come as easy as you might think. Everybody here is smart, but it was definitely hard, at least for me, at least in how they worded the questions.
Yeah, so they're actually changing it because step one is pass fail now. So they're doing a higher ratio of multiple choice questions to short answer, which has not been done before, at least here at Penn State. So yeah, practice questions for the win, 100%.
For a win, yeah, most definitely. I think, like, to get some validation to Penn State, though, I heard in the rumblings that they're actually considering adding some free response to step, I think it's gonna miss our
Really?
yeah, it's gonna miss our cohort. That's what I've been hearing from, because a lot of people at Mayo write the board questions, but they're piloting that right now. So maybe in a couple of years, you guys will have the benefit of getting to write out your thought process.
Yeah, that's, I mean, honestly, short answer kind of saved me on those exams. Um, because
Did
like
they
it
give you
actually,
partial credit?
yeah, they do. They
Okay, good.
do. Also, I just feel like it's easier to explain myself. I mean, no one knows me. I talk more when I get nervous. I also write more when I get nervous.
Yeah.
So it's like, okay, I'm gonna write everything, and it's kind of you throw enough darts at the wall, some are gonna stick, kind of thing. But that's interesting. I didn't know that. So I know we're kind of coming up on our time here, so just wanted to give some last words, some last nuggets of wisdom. I think that could be helpful. I think the first thing is, at least for us, if you're working with cadavers, especially, be respectful. They have to like anonymize a lot of it because like privacy and that kind of thing. But I just for example, I was looking at my cadaver and like I saw C-section scars on her abdomen. Like and I would I it really struck me like this person was a mother. She has a family. She probably has grandchildren out there that miss her dearly. And it's really important to like recognize that this person donated themselves for your education and they're not just like not you know what I'm saying? Not they're not the dummies. I don't know if you saw this, Noah, but a couple students at the University of Pittsburgh got
Yeah. I was about to
arrested.
bring that up. Yeah.
Yeah. I don't know if you have more details than me, but
No, from what I think, from what I actually hear, I think it was some undergrad students.
mhm. Okay.
So I don't think it was medical students, fortunately. But medical students have done it in the past. You can look it up. Like there have been some pretty bad stories out there. So, like Eleni was saying, don't be one of the people who gets kicked out because you were disrespectful to a cadaver. That's somebody who donated their time for you to learn, and it should be treasured. That was a human life.
Yeah, no, I know medical students like I've read about medical students that have like taken selfies and stuff with cadavers. Don't do that.
Don't do that. I think the best, like, okay, best policy, because some schools might not lay this out. I think the best policy in the cadaver lab, or when you're working with patients, period, it's like just leave social media and your phone out of it. Um, these are people coming to you for alive patients, like um, for a very private matter. They're entrusting you to take care of them. And it's cool because like especially for like your first couple of patients, you're like, wow, I like helped this person. This is so great. Um, and to bring it more back to relevance, like with cadavers too, you're super excited, but I would just stay off social media and pictures and all that. Like give it the sanctity and the respect that those bodies deserve.
Yeah, no, just don't be that guy. Like
Don't be
I think that's the fundamental. I read online that it's like this is the first patient that's ever entrusted to you. And it's like if you mess around, you know, you're screwing up your first opportunity. I think.
yeah.
And yes, they may not be here with us still, but like they still trusted you to take care of them. Just like, in any intimate patient situation, like, if you're an OBGYN, you're doing a pelvic exam, that patient's trusting you, right? To be gentle with them. If you're doing surgery, that patient's trusting you with their body. Same way the cadaver donor is trusting you.
Yeah. So I think like our biggest take home for like the cadavers, treat the bodies with respect. For that matter, treat everybody in the room with you with respect. And like if somebody's like joking around or like doing something inappropriate, like it's definitely okay to ask somebody to like stop that behavior. Um, I think moving on to like sort of like a lighter topic of like last minute advice, I think it certainly depends on how your course is organized, but do not fall behind. This is not one of those courses um, where you can get by missing a day or two and like catching up on the weekend. That doesn't happen. Once you're behind, you are behind for the rest of the course.
Yeah.
So stay on top of it. Um, do your Anki or whatever study resources work for you. Not everybody's an Anki person, but you read textbooks, read your textbooks. If you watch videos, watch your videos. If you do Anki, do your Anki. But have a routine, get it set early, and stick to it.
Yeah, no, for real. I put this is not like, oh, I skipped lecture, I can watch on 2 times speed later on. Like you need to go, you need to be in lab, you need to read the stuff beforehand. Because I will tell you when you're cracking open a chest cavity or whatever, and you're looking at a bloody mess inside and you have no idea what the heck you're looking at, and everybody else around you does, that's really bad because there's a lot to get through in every session. And it's bad to be the guy that's like, I don't know what's happening. So do prepare because you'll bring everyone else down too. Also,
Yeah,
it's just so much content. I spent like 2 weeks, 2.5 weeks straight studying for this exam, and it was still
yeah,
hard.
yeah. It I think anatomy universally, I think for a lot of people, this is where you feel like you're in medical school. For a lot of people doing the basic sciences, like for us before anatomy, we had biochemistry and genetics and histology, which a lot of people had, in undergrad in some form, one or another. You have to know biochemistry for your MCAT. Anatomy is something that less people have exposure to. And even if you did, it wasn't at this intensity. Um, so this is a block where I would say, regardless of how it's structured, if you have Zoom or it's online, go to class. This Some classes you can get away with purely third-party resources. I think it's worth it. Go to class, learn from your professors. These people have been doing it for 20, 30, sometimes 40 years. Um, they have wisdom that they would like to share with you. So I,
Don't
I
skip
think
over
it's
what your school gives you, is
yeah,
I
don't
think the
skip over.
takeaway.
Yeah, don't skip over what your school gives you. And just for like those who think that you can get away with third party resources, professors will write exam questions that aren't covered by um on your standardized exam. So you do need to pay attention to those PowerPoints. They're important. They will come back to haunt you. I promise.
Yeah, I think that's particularly for anatomy. I think you could probably get away with reading like the entirety of Lily or something for cardiology. Reason
Yeah.
why I mention it is because it's sitting right here next to me. I can't get it in the camera, but yeah. So, all right, I think that's a good stopping point. Unless Noah, you have anything else to say?
No, yeah. I would just say that for all of our pre-meds or people who are, depending when you're watching this, if you're getting ready to start anatomy, enjoy it as much as you can. Um, I think this was the first time where next to in the class I took afterwards, pathology, where we started formulating differentials and all that. This was kind of like the first time where I'm like, I'm in medical school. Like I realized like I'm here, like I'm doing this. So while it probably sucks for 7 weeks or Eleni's course a little bit less than that, um, just try and find the silver lining in that you're doing this for a reason. It's really important. Stay on top of your stuff and treat the bodies with respect. And it's really it formulates you. This is part of like shaping you into the doctor that you're going to be. So don't take it lightly. Your patients will appreciate you knowing where arteries and nerves are.
Especially when their chest is open and you're holding a scalpel.
If you're going into surgery, please, please do not skip on it.
All right. Well, that sounds like a wrap. Thank you so much, everyone, for being with us today. If you enjoyed what you heard or saw, please give us a like and subscribe. It really helps the channel. Follow us on Spotify or whatever platform that you're on, and we'll be back very soon with some more interesting topics. All right. Have a
Yes.
good night,
Thanks.
everybody.
See you.